Hi, I'm Lori.
And I'm Kevin, and this is No Longer Ashamed.
We are survivors of childhood sexual abuse.
And we're here to share with you that if you're a survivor, you don't have to be alone.
Our logo is a salamander, and the reason is a fire salamander can survive a fire, and you have survived a fire.
We want to help you with your journey to healing and hope.
We are all survivors together, and we walk this journey together, and you are not alone.
By telling our stories, we are hoping that you will have the courage to share your stories as well and find your voice.
Because stories are so important, and for so long I know that I wouldn't tell my story, but when I finally shared my story, that's when I got my freedom.
And this is our journey and your journey to healing and hope. So come with us.
Today we are doing a panel with former guests, which include Mike Chapman and Luke and Doug Carpenter, who is our author that we had on just recently. Doug, will you say the name of your book? I'm sorry, I don't have it handy.
Yep. Secret Shame, A Survivor's Guide to Understanding Male Sexual Abuse and Male Sexual Development.
It's an amazing book. I would recommend it to anyone. And so I thought, since we're going to be talking about PTSD, why don't we start? Doug has the DSM and he can tell us what it means, and then we can talk about what it does.
And maybe first explain what DSM means, because not everyone might know.
Right. So actually, in my book, in chapter 7, it's called Understanding Trauma. And as part of that chapter, I include the criteria for PTSD out of the DSM. The DSM is the Diagnostic and Statistical Manual for disorders for psychiatric diagnosis. So it's the main book. It's kind of the Bible of psychologists and psychiatrists and how we diagnose various illnesses. So it contains all the criteria and the symptoms that a person would have to be diagnosed with a disorder. And so today we're talking about PTSD. It's very complicated. The diagnosis is complicated. There's not a quick, easy definition of PTSD. There's several components to it. So the first part is that you have an exposure to an actual or a threatened death, serious injury, or sexual violence in one or more of the following ways. Number one, that you directly experience the traumatic event. Number two, you can witness in person the event as it occurred to another person. Number three, learning that the traumatic events occurred to a close family member or a close friend. And number four, experiencing repeated or extreme exposure to aversive details of a traumatic event. So people like first responders, people who collect body parts, coroners, police officers, those kinds of things might be somebody who can experience PTSD. In some circles, we call that vicarious trauma, that you're actually getting, you're becoming traumatized by someone else's trauma, but you're exposed to it through exposure. And then the next part of the diagnosis or the definition would be the presence of one or more of the following intrusion symptoms associated with the trauma beginning after the traumatic event has occurred. So you, number one, could have recurrent, involuntary, intrusive, distressing memories of the event, or you can have recurrent, distressing dreams in which the content and the emotions in the dreams are related to the traumatic event. And in children, they can have dreams too, and it may not be the exact content, but it will be very frightening dreams for them. And then you can have what's called dissociative reactions. This is having flashbacks in which you have feelings or acts of the trauma as if they were recurring and you were re-experiencing and reliving them. You can have intense or prolonged psychological distress at exposure to internal or external cues that somehow resemble components of the trauma. And you have a physiological reaction to either internal or external cues that represent the trauma. Another important or prominent aspect of PTSD is the presence of avoidance. So people who are traumatized tend to then avoid triggers, stimuli, things that are associated with the trauma. So you do your best to avoid distressing memories, thoughts, feelings associated to the trauma. You may have efforts to avoid reminders such as people, places, or things, or activities, situations. And then you have some kind of negative alteration in your thoughts and your mood associated with the trauma, especially after the trauma. There may be an inability to remember aspects of the trauma because your mind blocked it out, you dissociated. You might have a persistent and exaggerated negative belief or an expectation about yourself or the world around you. You may think like, I'm bad or the world's a terrible place.
You know, as talking about PTSD, post-traumatic stress disorder, that it does manifest in a lot of ways. And I know for some of us who have repressed that, we're walking around with post-traumatic distress disorder and we're acting a certain way, but we don't even know that we have it.
Mm-hmm.
And so I think the fact that when we can identify it, that, you know, that's when we can at least start looking at it differently and making some decisions about it.
I had a very kind of sad experience today. In church, we do what's called Grapple. We're teaching Bible study to junior high kids. And two of the kids today were identifying things that sounded kind of like PTSD. Yeah, two of the kids in Bible study, the one boy, he was talking about, we were talking about Jesus bringing light into the darkness. And we were asking them, you know, have you ever experienced, you know, being out at night in the dark alone? Is that, you know, was that a scary thing? The boy was talking about how he's afraid of being alone all the time. And he is afraid of being alone, especially at night, because he's fearful of what's out there. And he has night terrors that of this tall, dark person coming to get him. And the whole time he's describing this, I'm thinking, oh my gosh, this kid has PTSD and he's only, you know, 6th grade. And then this other girl chimed in and saying, I thought I was the only one that went through this. And she was talking about having night terrors, nightmares, and also being afraid of being alone and so forth. And I was just thinking, this just sounds so much like PTSD. And I just had to pray for them because I felt so sad about these young kids. But it also made me realize I was their age too when I was having night terrors and having these same fears, and realizing that I had no idea what was causing it, or what I couldn't have explained to an adult why I was going through this. I just knew it was part of my life, this fear I had all the time.
Right, and so many of us have repressed memories, and I didn't remember my own abuse until I was 30. So yeah. Any kind of bad dream I would have had at that junior high age, I would have no context for, just like them.
Yeah.
You know, there are lots of different interpretations of what dreams are and what they actually mean. But I think a lot of times dreams are just our brain's continued effort to process what we've lived in our daily experience, and trying to process that and trying to store it, and how do we resolve it and how do we put that away. So I think, you know, dreams are very symbolic. You know, you can actually dream about the trauma itself, or you can dream in a symbolic way about the trauma that replicates the emotions that you experienced during the trauma. And it's still your brain's way of trying to process the traumatic events.
So what is the benefit of understanding, yes, I do have PTSD? So like Mike and I were saying how we were walking around with PTSD, but didn't know it because we didn't have memories. And I often wonder, did anybody notice? Did teachers notice in college? My college counseling professor, did he notice that I was a person with trauma and diagnosed?
I think PTSD is hard to spot. I mean, unless you have like a significant startle response that's noticeable, or you have some kind of symptom that's blatant. Usually, I think people, before they would identify that you have PTSD, would recognize symptoms of that you might be depressed, you might be withdrawn, you might isolate, you might have a lot of anxiety, or maybe panic attacks. I think there are other symptoms that are going to be more prominent, that people are going to notice those and not recognize, oh, these are actually symptoms of PTSD. You know, I think that takes more of a trained professional to figure out what's behind the depression, what's behind the anxiety, what's the root of that, what's the origin of that, to then be able to identify it as PTSD.
For me, you know, I went to my doctor and I explained the symptoms I was having. I had taken psychology, so I knew what the symptoms were. I figured it might be PTSD, but I wanted to get a formal diagnosis. And he diagnosed me with everything, you know, anxiety disorder, depression, all that. It wasn't until I actually went to prison and they diagnosed me with what's called CPTSD, complex post-traumatic stress disorder.
Mm-hmm.
Yeah, and I don't know if the doctor that you went to was a medical doctor, but I think a lot of the times medical doctors are just so used to just treating symptoms. Give me something that I can give you a pill or a fix to, and PTSD is more of a mental disorder. It's a very complex. It takes talking to a therapist or a psychologist to work through the components of the trauma. It's not just a symptom you can fix, like it's in the medical model. And so I think they often don't dig deep enough. The average medical visit is 7 minutes, according to the research. And so your doctor doesn't have time to diagnose you with PTSD in 7 minutes. It's too complex of a diagnosis.
Well, I think partly we're, like you're saying, we're diagnosing the symptoms, but we don't even realize what happened to that person, especially if it's an adult and they're going in because of anxiety and so forth. We don't necessarily ask them, well, what happened to you? What could, and sometimes we don't even realize it. Like Lori and Mike, you didn't have the memories at that time necessarily. And so if you don't know that something happened to you, I know sometimes ADHD is misdiagnosed because when you're having PTSD, you're in that state of hypervigilance, that state of alertness all the time. And so you're always kind of wound up because you're always alert and paying attention to everything that's going on because you're in that hypervigilant kind of scared, you have to pay attention to everything at once state. And so people that are actually experiencing PTSD and are in that hypervigilant state all the time, they're given meds for ADHD, which isn't going to help them necessarily.
Right. It's actually going to make somebody with PTSD worse.
Yeah.
I know there's overlap in the symptoms. Just like an ADHD kid is full of energy, can be hyper, can even be hypervigilant, can be attuned to his environment. He's easily distracted. But in PTSD, it's a true hypervigilance that out of a sense of fear and anxiety, you are on high alert about your environment around you. And so if you give a person with PTSD a stimulant, which is what you treat ADHD with, it's going to increase their anxiety and their symptoms are going to get worse.
Yes, that's exactly what happened to me. As an adult, I was reading from a friend, you might have adult ADD. And so I got diagnosed and they gave me the Ritalin or the equivalents of Ritalin. And it was speed. And it was helpful because it gave me more energy to get things done, but it was speed. Whereas I think true ADHD people, it calms them down.
Yes.
It has the opposite effect. And it certainly didn't do that. Right. I was like, I was very wired. And it took a while to realize, maybe I don't, especially when the abuse started uncovering and I realized I had PTSD, which is 2019. I realized I probably had PTSD and I pursued that.
Well, I think a lot of problem, as a psychologist speaking, a lot of men don't like to talk about their trauma. So they come into therapy and they don't necessarily tell you about their trauma right off the bat. So you don't recognize that they have PTSD until their story continues to unfold. And then you start talking to them. Well, it sounds to me like you've experienced a trauma. And then you dig into that more. A guy might come in because they've gotten in trouble with the law, or, they're now on probation from a DUI, or they're depressed or they're anxious or whatever the presenting problem is. It's not till you get them actually talking and build some rapport to where they will talk about their underlying trauma that you then recognize they have PTSD.
It took me for a long time just to get to that point, especially with the psychologists in the jails.
Yes.
But once you get there and they're willing to talk to you, which that's I've said before, the psychology isn't as good as it should be in the jail system and the prison system itself, but it did help. Help me reach that point where it's like, okay, I have this. There's ways I can treat this, There's different things that I can do to get past this and grow.
Right. Well, and I mentioned this, this is in my book, but I also mentioned this in the prior podcast with Kevin and Lori, is that there's a lot of research that will back up that men wait an average of 25 years before they ever tell anyone about their abuse. So, how can you diagnose someone with PTSD when they won't even talk about their experience? But yet they're coming up with symptoms, and you're recognizing symptoms that look like other disorders because they're not telling you about an original trauma. out of shame or fear, or worried that they're not going to be believed, or that they're going to, appear homosexual because of what was done to them or what they had to do, or whatever.
Many don't even see what happened as abuse.
Right. Well, and that's something I thought of a minute ago when somebody was saying something, and I thought, well, so many men don't even recognize that what they experienced was abuse until they start talking about it with someone, and then someone confirms for them that they were abused.
See, that for me, that was my case, that it wasn't until I was actually intoxicated when it happened, but I was talking to a friend and they blatantly straight out told me that's abuse.
Right.
That's sexual abuse. And I didn't know that. Because I don't know how many people do know my story. I was 16. The girl that was sexually assaulting me was 22.
Wow.
So in my mind, I'm trying to be like, okay, I want this or whatever, which is wrong. But I was 16. I didn't know how to process it.
Yeah. So I think one of the things we're describing is the advantages of knowing that you have PTSD is also knowing how to address it. Once you learn that you've got PTSD, this is why I'm in this hypervigilant, this alert state all the time. Now what? So how do you, once you realize it, you've got PTSD, what does that do for you as far as how do you address it once you've learned that?
What tools do you use? I heard Luke say, then I was able to, sounded like, use some tools to.
Yeah, I've been using a lot of tools, I guess. Yeah, just trying to find a way, like when I do get an anxious anxiety feeling, to deal with that first. Calm myself down and go, okay, why did I get to this point? How did I get to this point? How can I change this in the future?
So recognizing the triggers, and then when you realize you've been triggered, you understand, okay, this is a trigger. It's because of what's happened to me. I don't have to react. I can actually control how I'm going to deal with this.
Right. I mean, I still have my issues. And, I still have the nightmares and all that, which isn't fun. But, it's just something I'm trying to work through. I've been looking into, I think it was rapid eye movement.
EMDR.
And I saw another one recently. They put you in some anesthetic or something. They inject something into you. But I was like, about that.
Yeah, that's the Stella ganglia block.
Yeah.
And our friend Kevin had that because it gives you a moment from the hypervigilance. Right. And it didn't actually take his nightmares away, but actually once he had him, while he was having them, they just flew out of his head.
Huh.
They said they'd never heard of that. But I want to get to this later after some more people share their stories, some different techniques. But Luke said calm himself down. Mike, what was it like for you when you recognized you had PTSD? What were your coping mechanisms?
First, just learning about it, and then learning to identify those parts like the hypervigilance that, oh, that's what that thing is. Oh, okay. And I know I was involved with Celebrate Recovery, Christian 12-step group, and talking about that anywhere I could where I could talk about this. I had a Christian therapist at the time, realizing, oh, he was not trained for PTSD. Okay, let's find someone who is. And then I got my current therapist who is trauma informed, but not a Christian, but has done phenomenal work with me for the last 2 years, dealing with these things, helping me to face the traumas and work through the pain. And it's taken a lot. Still not resolved. Symptoms are better, but yeah, there's still issues there. Definitely. The hypervigilance doesn't seem to be an issue anymore. I'm pretty sure I'm healed from that, but I still have flashbacks. Pretty bad ones. About a year and a half ago, they were really bad, but they're less bad. Flashbacks are always awful, but they're better. They're less severe now. So instead of a 10, they're maybe like a 7, which is still not great, but improvement. And it's just a way of your brain just processing that trauma and dealing with it. And really, I'm really thinking it's getting it out as well. But I've had so much different types of trauma with so many different individuals involved. There's just a lot stored in there, and it's taking time to get through it all, I believe.
Mm-hmm. Well, I think for me was recognizing triggers, and that was a huge one because generally when I had a trigger, I would just react, and that would send me, into the react stage. But now when I recognize a trigger, I understand where it's coming from and I can learn how to deal with it in a healthier way. For me, I don't have night terrors anymore, and I still get flashbacks as far as when I'm awake, when I'm, certain things will bring me back to that certain times or certain incidents, but I don't have the night terrors anymore. And I feel that was a direct result of when I actually got through forgiveness of the perpetrator, and because it was right after that I literally got healed from night terrors. I no longer had them, and I haven't had them 18 years now. I haven't had a single night terror, and they were a fairly common thing for me up until that point. So I think it was coming to a state of peace with my perpetrator that I no longer felt that I had to be guarded against him. I don't know exactly what it was, but he was no longer a threat to me. And so I no longer had the night terrors. But I think a big part of what it was also, like you were saying, Mike, just talking, being connected, being able to talk with people, whether they're fellow survivors or family members or just your support group, your friends, the people you trust, being able to talk about the trauma in little bits at a time, just enough that's safe. Even for me, doing this podcast has been a huge growing, just because now I talk to a lot of different people about being a survivor when I never would have before. I talk about, I do a podcast. Well, what's the podcast about? Well, I'm a survivor, and that's what it's about. And this is not something I would have normally brought up in conversation, but it has made it easier to talk about it. And I think that has also been a huge part of growth, as far as I'm not in that alert stage. I'm not hypervigilant. I'm not worried about what other people are thinking of me necessarily. I know a lot of my issues before were, I always felt that people could tell there was something wrong with me. And that was putting me in a state of trying not to do anything wrong all the time, or being aware of if I did something wrong. So all of those things, I think, have combined to help me get through to this place where I'm, like you said, Mike, it's still ongoing. I still get triggers. I still notice things. I still screw up and, kick myself about it, but it's not overwhelming.
Yeah, I know previously you mentioned avoidance. And for me, because fear and distrust of other men, so avoiding those relationships, because that internal fear that that person might hurt me, even when it's not even conscious. But so I tend to avoid male friendships, relationships, and so forth. So trying to, and now understanding those avoidances and where that comes from, and then purposefully doing the opposite, purposefully getting involved in men's groups and men's ministries to try to overcome that. But understanding where it comes from helps.
Still have avoidance issues with women. It's definitely hard to push yourself through that. I don't know how you did it. We'll have to talk. Maybe you can help me with that.
Yeah.
I think it's important to find safe people, like Luke, find someone, maybe someone at church, maybe someone, in a circle of friends that's safe, and just being able to talk about what you're going through with that person. And saying, because I work in construction, and when I first got into construction, there was a lot of gruff, macho, tough type guys that scared the hell out of me. My dad was a violent kind of person who had a very violent temper and was scary. So I found men to be scary. And when I first got into construction, it was hard. A lot of the time, there were certain people that were like the men that were foremen or something that were my bosses. I had to learn how to deal with them in a way that was constructive, even though they scared the hell out of me.
What you guys are describing there is something that in psychological terms, we call it exposure therapy. So the things that you're avoiding, the things that you're trying to stay away from, part of your healing is slowly exposing yourself to those things and feeling like you're gaining more power and control over those things that you've been avoiding or that you've been fearing. And so one of those, like if Mike has talked about, and Kevin, you've talked about having difficulty with male relationships, and Luke has trouble with female relationships because your perpetrators were, the sexes that you have problems with. And so gradually starting to expose yourself to those people and build relationships is actually healing, but it's often a very slow process. And that's a part of exposure therapy, which can be really helpful in gaining control over PTSD. Lori was asking about some techniques, and I would like to just review a few important ones here. We talked about being able to identify your triggers. That's just increasing your own self-awareness. Being able to identify through self-awareness, what are my triggers, what are the things that make me feel uncomfortable, bring on my symptoms. And then because the person with PTSD is at such a heightened state of alertness, it's very important that they learn mindfulness techniques like meditation, prayer, yoga, things that calm their system down. I often tell people, use apps on your phone like Calm and Breathe and progressive relaxation apps, things that help you center and learn to be in touch with your body and helping your body relax. Now, on the flip side of that, another super helpful thing for people with PTSD, especially if they're stuck in the freeze mode. We talk about the flight, fight, freeze, fawn, these different ways that you can respond, is martial arts. Because so many people with PTSD feel like they've lost some kind of power and control. And getting involved in some kind of martial arts trains you to be strong and that you have power and control over your body in a controlled way. So many people are afraid with PTSD that if I actually let all this out, I'm going to let it out in an out of control way because I have so much stirring inside of me. And martial arts is a great avenue to help people gain back that sense of power and control in a controlled way. And you guys were talking a lot about dreaming and still having dreams and nightmares and how difficult that can be. And one way that we deal with that in therapy is talking through the nightmares, but also trying to learn a technique called lucid dreaming, where we try to help you imagine that next time you have that dream, in the dream that you're going to have some power, you're going to have some control, you're going to have the power to change that dream. And what do you want that to look like? Well, we might draw pictures of it. I might have you say to yourself before you go to bed that night, okay, if I have a traumatic dream tonight in the dream, I'm going to be able to escape, or I'm going to be able to run, or I'm going to be able to punch my perpetrator in the face, or, something that's going to give you some sense of power and control. And you continue to say that to yourself until at some point you do start to become empowered in the dream and be able to protect yourself. We already talked about exposure therapy, but another thing is learning how to self-soothe and increase your own self-care. Like when you are triggered, what do you do with that? How do I calm my system down? How do I self-soothe and bring myself back down to a stable level versus, becoming so anxious? And talk therapy is huge with PTSD. Cognitive behavioral therapy, a form of therapy called ACT. It all examines the language that you're using in your head about your PTSD, because so many people with PTSD use language in their head like, I can't tolerate this. I can't take this. I can't accept this has happened to me. I've got to protect myself from ever letting this happen again. Well, we've got to start reworking that language that you're using in your head to empower yourself, not keep yourself backed into a corner and constantly in a state of fear and anxiety. And then, Luke was talking about the rapid eye movement therapy. That's called EMDR. That's helping your brain reprocess the trauma. And it's a very effective form of therapy for people with PTSD. So there's lots of techniques that you can learn if you're a person with PTSD. It's just getting connected, I think, with a trauma-informed therapist who can help guide you through that process instead of, you just trying to do this on your own or figure out what's best. If you need help, reach out and ask for help. Find a trauma-informed therapist who understands how to use all these techniques in relation to your trauma.
And if you're feeling like, it's resonating with you, but you still haven't shared your story, that's where it begins. Because like Luke said, he didn't actually know it was what it was, but he shared his story, somebody validated, and then he's been able to move forward. And that's why we're so big on sharing your story and finding someone safe to share it with, because not only does it help you, but down the road, then your story begins to help other people.
Yes. Which is, if you look in the research, one of the ultimate last stages of healing in 2 different models of healing from sexual abuse. The last step is going out and sharing your story with others. Mm-hmm. And actually, if you look at the steps in AA, what's step 12? It's carrying the message to other people, right? Yeah. That's such a huge step in the healing process, is using what you've lived through to help someone else along in their journey.
I think one of the important things to remember too about realizing you have PTSD is it's not necessarily an excuse for your behaviors. If because of your PTSD you react in certain ways, you do certain things, you're in that state, but it helps explain your behaviors. So because you're understanding, you can use that as a way of learning how to deal with these behaviors and do them better, react differently. Maybe not react, but actually handle things differently. So it's not necessarily a reason to have an excuse for what you do when you're ashamed of doing something wrong, or, you're ashamed of the way you act. It's more of explaining it so you understand it, so you can learn how to address it.
Well, and explaining it and learning about it is empowering to yourself. Because I think if you have PTSD, you have this sense of the trauma is controlling me versus I have the ability to control the effects of the trauma on me. And that's 2 totally different ways of thinking.
Yeah.
You have to decide that I am not going to allow this trauma to control my life. I like a phrase that Joyce Meyer says, and I think it's, you can let your situation change you, or you can change your situation. And I think those are powerful words. Are you going to let your trauma control your life? Or are you going to find ways to control your life so your trauma is not controlling your life? And I know that could take a lot of work, and that might be easier said than done, but it really is true. It's just like somebody who struggles with alcohol. Are you going to allow it to control your life? You have to make a decision. Who's going to be on the control panel of your mind?
Right. Are you going to do the work it takes? Because it does take work. And I think that's where people can get in a comfort zone, and just kind of go, hey, I'm good. But I think that it's like Doug mentioned, it's that daily meditation, prayer, whatever your way is staying connected so that you do have that mindfulness when it occurs. One of the things I wanted to bring up today is that our friend Dr. Lipov, who he and Shauna Springer, Dr. Springer, are the ones who do the stellate ganglia block with our friend Kevin, who we interviewed. And what Dr. Lipov proposes is it PTSD or is it PTSI? Is it an injury? Because if it's an injury, we have a little more control over it than if it's a disorder. And so that's just something they're kind of putting out there, because in the book, of course, the DSM-V, it's a disorder, but is it something that we can get a handle on? And if it is, then maybe it's an injury. And if it's an injury, does that give us more hope?
Right.
Well, absolutely. I've never really thought about it in those terms. And I'm glad you said that, because really trauma is a wound, right? It's not a disorder. It's a wounding, and wounds heal. You can heal from PTSD. You can recover from PTSD. But it's just like you said, Lori, it's putting in the work and the time. And it may be arduous and it may take a long time, but it is overcomable. You can overcome PTSD and the impact that it has in your life.
What you just said was so hopeful. And I think what happens is we forget it's spiral. Like I remember when Kevin was triggered in the beginning and he thought, oh no, I thought I was better than this. I thought I was past this. And so he thought he was at the same place. But then he realized, oh, it's spiral. I'm here, but in a different way. which I feel like that's hopeful.
Right.
Doug, I think another thing you said that was important was you have to put in that work. For me, putting in that work, doing these podcasts, I'm writing a book, all that is putting work in and sharing my story in some way. And I'm able to help other people. Yeah, but it's helping fix what's going on in my head as well.
Yeah.
Well, and that brings up a great point. You said you're writing a book, but even just the simple fact of journaling, find an effective way for you to process your emotions. Because when you write, it activates another part of your brain. Our emotions are a right-centered brain activity. Your writing skills and language is a left brain activity. And so anytime you journal, you write things out, is a different level of processing the emotions that you're experiencing. And actually writing and journaling, it can be a very effective tool. And sometimes I will even have people write out their nightmares and their dreams, and let's process through that. And so where in the dream can you have a sense of power and control?
Yeah, that's good.
And often, on more of a religious standpoint, sometimes I have people go back through their trauma and where was God through all this? He did not abandon you. He may not have miraculously stopped the trauma, but God has never abandoned you. He is with you. He sees your pain. He's a man of sorrow, acquainted with grief, is what the scripture tells us.
I think what I've heard from women is they're afraid if they tell their story that they will lose control. They'll cry, they'll be out of control, and they'll never get it back. And I often remind them, this is secondhand. It's already happened. But, and often they'll say, I'm afraid I'll start crying and I will never stop. And I remind them, you will run out of tears. But that is a feeling that I think a lot of people deal with. They're like, I don't want to jump back in this. It was so hard the first time. Why would anybody want to do it again?
I was just going to say, but you look at things like the Me Too movement, right? A lot of women came forward in that, and they told their stories about how they were sexually abused. And a lot of other people started coming forward and sharing their story. And that was very impactful on even how we look at that,
Yeah, I think many felt the environment was ready to the point where they would be believed. And so that empowered them. And that's the power of story, that somebody else shares and then you share because you feel, oh, they're being heard. Well, let me go ahead and share my story too, because they felt empowered. They felt safe too.
Right. And in that, it gave them power to work through that,
I think that applied for men as well. A lot of men, famous men, started coming out and sharing their story, and then that empowered many of us as well to share our stories publicly.
Unfortunately for me, it was someone who committed suicide, and I knew that they were a survivor, and I felt like, he was brave enough to talk about it, but it still impacted him so much that he couldn't go on. And one thing I wanted to ask you, Doug, and in your descriptions of PTSD, one of the things I wonder is neglect considered a cause for PTSD? Because I know neglect is a severe trauma, but it's not always looked upon as trauma.
Yes, it can be. That's my answer to the question. But the DSM doesn't specify actually what causes the PTSD. So it can be from neglect. It can be from abuse. I know people who have PTSD from neglect because they had to fight or wonder where their next piece of food was coming from.
Yeah.
And now they are very traumatized by that.
Yeah. Yeah, and I know that for a lot of people, their story is very complex because it not only involves traumatic events, abuse, and so forth, but it also involves neglect and just the absence of someone there when they needed a parental figure or someone, a caregiver.
Yes. In anytime you're being abused, you're also being neglected because you're not receiving nurturance that you need. You're receiving abuse. And if you're not receiving nurturance, you're being neglected. Yeah. So it's a component of abuse.
I never even thought of that, honestly. So you're giving me insight as well as everyone that's listening.
Mm-hmm.
Right.
Yeah, I think
that's why I like Claudia Black's definition of abuse, which is anything less than nurturing. Well, you can't be, if you're being abused, you're not receiving love, you're not receiving nurturance, you're being neglected. A whole part of you as a child is being neglected in that moment and harmed. And that complex PTSD comes about when a kid just received layers and layers and layers of trauma. It keeps happening over and over and over. And in some ways, it can happen, that complex PTSD can continue to happen if you are somebody who has nightmares, because you keep reliving it over and over and over. And it just keeps adding to the layers of trauma. So it's important that if you're somebody who is really struggling with PTSD symptoms, that you find a trauma-informed therapist who can help you with this. Like I said, it's treatable.
Yeah, Doug, I know you not only help survivors, but you're a survivor yourself. What has helped you on your own journey dealing with PTSD and so forth? What has been helpful to you?
I would say that I've not experienced too much of the standard symptoms of PTSD in relation to my abuse, but I think the big thing that has helped me is connecting with other men and being authentic about what happened to me in my abuse, and then writing, research, and understanding, gaining knowledge about this, because, and I talk so much in the book about this, is when a boy is, and I mostly work with men, so I mostly talk about abuse in relation to men, but a child who's sexually abused comes to believe so many lies about themselves and the world around them, that undoing all those lies was the thing that helped me the most. I had to examine, what was I saying about me to myself as somebody who had been abused? How was I lying to myself about the situation and who I was? And learning to undo that and change that language in my head was super helpful. So educating myself, research, and writing, I think, have been three of my biggest weapons against the effects of trauma.
Mm-hmm.
For me, I was one of those who said, I was raised by my drunken alcoholic grandpas, and it's amazing nothing ever happened to me. And I hear people say similar things, and to me, it's a red flag. I think, they've had to tell this story to protect themselves. I don't ever feel it's my place to go, by the way, probably not. But I would say, if you're telling yourself a story like that and you're feeling also the trauma symptoms we've talked about, that it would be worth looking into. You may think you escaped something, but maybe you didn't. And if you were like me, you didn't have any adults around that were nurturing enough. So you had to create a new story. And then you had to protect it with everything in you. And I remember when I made that realization of, oh my gosh, this is what I used to say.
Yeah. Lori, you were talking earlier about people who think if they let this out, that they're going to start crying and never be able to stop. One thing that I think is helpful in seeing a therapist who's trauma informed is I try to create a safe space for clients to have that meltdown with me, that I can handle your emotion. You can cry with me. You can have a meltdown. You can scream and yell inside my office. I can handle that. I will be a safe container for your emotions. And you know what? You will get past it. You will not cry forever, because we're going to establish that this is no longer happening to you. This is you telling your story in a safe place, in a safe environment, and no one's going to hurt you.
Yeah, I think that's huge. I know for me, it wasn't just the crying, but it was the rage.
Yes.
I was afraid of any emotions just because my father had scary emotions. So I thought all emotions were scary. So being able to express emotions was frightening. I mean, terrifying for me when I first started going to therapy, and then having a safe place to actually try it out, to actually try emotions and learn that, yes, they were scary at first, but they didn't destroy me. And one of the things that one of my wife's therapists has said is emotions are information. And I think that I wish I'd known that back when I was first going through therapy, but it's really important to express your emotions because you kind of get through them and down to where they come from. And I think that's one of the biggest parts of expressing emotions is realizing where those emotions are coming from and why they're so scary for you.
Well, and I think another huge piece is people have to understand emotions are not right or wrong. Yeah. They just are. And I think we as a society think, oh, rage is a bad emotion. Fear is a bad emotion. They're not right or wrong. They just are. And it's okay to express those emotions in a controlled, safe environment. It's about externalizing that and getting it out.
Yeah.
And having someone to listen.
And knowing it's okay. A lot of the women I work with, they come out of a recovery, drugs and alcohol, and they're like, I'm feeling, and they're mad because all they've known is either, rage, sadness, or happiness. They don't know anything in between. And I go, it's okay to feel, just feel. And they're like, but I don't like it, right? Mm-hmm. But you get used to it. Anything new that you have to do, you eventually get used to it. And so feeling the feelings is really important.
Well, and as survivors, we've so long had these coping mechanisms that enable us to avoid feelings, enable us to, hide from our feelings. So going there is a scary thing. And we're used to just coping in ways that we can hide our feelings. For me, it was drugs and alcohol. I was able to numb myself. So getting to a place where I wasn't numb was not necessarily, it didn't feel safe, but it was healthy.
Yeah.
Yeah. Talking about your feelings, I know before I started dealing with this and knew where it was coming from, I had very scary emotions, outlets and outbursts. Didn't know I had a very long fuse, but boy, when that fuse blew, it was a volcano, and I would scare myself from that. And yeah, I don't rage like that anymore, but definitely those feelings were there, and I didn't know why they were there. Now I do.
Yeah. For me, I turned them all inside so I didn't upset anybody. And so then that spells depression. Mm-hmm. So now I go to the doctor and I've got depression and they're giving me meds, still not getting to the core because I don't know. I have never told the story. And so again, it's like as we recognize and move forward and keep doing the work. And like what really spoke to me about Mike's story is he had a story and he kept doing the work, and then he had another story, and often that is the truth. It's not always just one and done, right? Because if we are victimized as children, we might get in relationships where we're victimized, or we might have other friends or things that happen, and as we uncover them, we do the work, and God's so gracious. He doesn't give it to us all at once. I remember when I started remembering, I said, God, just give it to me. Let's get this over with. Mm-hmm. And I was really mad, but that I didn't get it all, that I got it piece by piece. But now I'm grateful. And I think there's probably some things I haven't remembered that probably aren't necessary in God's grace. He gave me what I needed to do the work I'm doing. Kevin started off with kids that were telling a story. And as people in leadership, what is our responsibility? Like, okay, we recognize they have PTSD. If we recognize abuse, we know we have to call CPS. We know we have to do something. But if we recognize trauma, what is our responsibility?
Well, I think that depends on the setting maybe that you're in. It's a little hard for me to answer that question because I'm a licensed psychologist. And so there are certain laws I have to abide by, so I can't, it's been so long since I've just been a regular citizen, if you could put it that way, that I don't even know how I would think as a normal citizen who's not under a mandate from law that I report issues of trauma or abuse or neglect. But I think anytime that you see trauma or a kid reacting in a way that causes you to be suspicious, first you need to examine, does this person have a caregiver that you can trust, that you can reach out to and say, hey, I noticed this, I'm a little concerned. Have you had your child talk to anyone? Have you ever thought about that this could be a sign of something more significant than what, just this is how they are, but I think you have to be careful about that, in the setting that you're in, and making sure that their caregiver is someone who's trustworthy and will care for them.
And isn't the perpetrator.
Yeah.
And it's not the perpetrator.
Exactly.
My sister leaked something when she was in kindergarten, and they went right to my grandparent, who was my babysitter, and that just nipped that right in the bud. She was threatened within an inch of her life that she would be killed if she ever shared anything ever. The teacher just went right to the caregiver, didn't even consider it might be the grandpa causing the trouble.
Well, we're in a position, like for me, I do know the background of one of the kids, and I know that their caregiver is aware of the situation, and that, I just didn't realize the extent of what was affecting that kid and how it affected him. But they are aware. I know the parents. The other person, I've never seen this child before. I don't know this child. I don't even know the parents, so I don't know the situation. But immediately my thought was very much like what you were saying, Doug. I need to maybe become aware of who this is, what the caregivers, who they are, what their situation is, maybe just kind of learn more about them before I do anything else. But it, like you said, Lori, it's a red flag, and we need to be aware of these red flags and kind of pay attention to them, because they could lead to maybe finding out, something else is going on. But you can't necessarily jump on it. You kind of have to learn the background first.
Well, and I think you have to be very careful as a lay person if you suspect a child is being abused or neglected or traumatized in some way. There are specific ways that you have to ask those questions to children. And only a trained professional, I think, knows how to do that, because you don't want to suggest something is happening. You don't want to somehow implant thoughts that maybe aren't there. So you have to ask them in very specific, trained ways to explore that. So it's really trying to potentially help that child connect to a trained person who they then can explore that with them. That I think is really our responsibility if we can do that in some way.
Yeah.
So either through a school counselor, a guidance counselor, somebody who can appropriately have contact with the child and ask questions in a non-leading way.
So my grandkids are trauma kids. They're foster adopt. And so they have trauma behavior. And some of the teachers know they're adopted, some don't. And if they were to jump to the conclusion that the parents are not good parents without finding out more. But I teach coaching. I teach people to be coaches, and I teach them to coach adults. But also there are going to be times when things come up or things are said. And so for me, working with homeless women, I know I'm a mandated reporter. If they tell me they're doing something that's abusive to their children, yes, I have to tell. But also when we see signs of trauma, I just don't know if we have, we don't want to, if a child's trying to tell us something, we don't want to miss a clue and be like, but also, like Doug said, we don't want to jump to conclusions. We don't want to jeopardize the child more. So I just wanted an awareness around that. Since Kevin brought it up, it just really made me think about. And because a lot of times a parent will say, oh, that kid's always lying. They're always, but isn't that what abusers say, to throw people off the track? So
I think the question is also appropriate for those working with adults, just if you suspect trauma, or they're saying, yeah, I'm having night terrors all of a sudden, and I don't know why. I think the question would apply equally to adults that we suspect, gee, maybe they had trauma.
Well, and when I'm training other therapists and psychologists, I have trained them that especially with men, you have to directly ask, have you ever been sexually abused? Because some of them won't tell you. So you have to ask. You have to be direct.
Yeah. And like we said before, sometimes they don't even realize what they may have experienced was abuse.
Yeah.
So, yeah.
And also, as a coach, there's been many times I've said, are you willing to get a counselor? If we're going to move forward, because I'm recognizing, are you willing to get a counselor? Because I think this is more of a counseling situation than a coaching.
Right. And I think so many of us, and I'm sure many listeners, are not professionals, but not only are survivors, but may interact with other people. And I would think just walk alongside them and encourage them on their journey and help direct them to whatever resources are available to them, whether that's professional or pastoral or coaches or whatever.
I'm a little leery of pastoral because I have felt like often pastors are put in a position to be a counselor when they're not. Right. And have often I've had women who have been told never to tell their story. I've also had them believe the other person. And so when Doug says professional, I feel like if you feel like you have a story, get professional help. And then if you want to go to a spiritual guide or a pastor, at least you have a counselor that's going to validate you. If you come back and you're like, my pastor said blah, 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 he's going to go get a new pastor, right? Because, and pastors don't intend to do this, but they just don't have the knowledge. And not all pastors. I feel like Kevin's pastor was really, really brilliant. I feel like Kevin had to train him a little bit, tell him what to expect, but it's not their wheelhouse. And if I'll say, I never send people to their pastor. I always send them to a counselor.
And personally, I've had a lot of bad advice from well-meaning pastors over the years.
Yes.
So.
If you have a spiritual problem, you see a pastor. If you have a mental problem, you see a counselor. If I need to see a cardiologist, I'm not going to go see a proctologist.
Like I've had experiences even with counselors. The guy was a counselor, but he was also a pastor. I've told this before where he was just like, oh, well, it was your fault, or, and I ended the session. I ended never seeing him again because he was blaming, and, it wasn't right.
Mm-hmm.
Well, if you've listened to what I've said closely throughout the podcast, is I haven't just said find any therapist.
Right.
Therapists are not equally trained. You have to find a trauma-informed counselor. That's somebody who's studied trauma, who's taken extra training in how to deal with trauma. We all come out of graduate school with a certain level of base training, and then we all have to continue the learning process. And not every therapist is a trauma-informed therapist. And if you're dealing with trauma, then you need to find a trauma-informed therapist or psychologist.
One of the things we also talked about in one of our episodes was also you should find a therapist that you're comfortable with, because if you're just dealing with this, you might not be aware of your triggers, and you might go to a therapist who's a man, and your perpetrator was a man, and this man might remind you of your perpetrator, and you might be forcing yourself to go to this therapist that is making you really uncomfortable. And so pay attention when you first start going to therapy if you're feeling safe. And if you're not feeling safe, it's okay to find another therapist. It's okay to shop around until you find the one that feels good to you, that feels comfortable. You have to feel safe. You have to be able to trust this person.
Mm-hmm.
Absolutely. I would highly agree with that. There's actually even some research that shows that it doesn't matter what type of therapy the therapist uses. The healing component is that you connect with the therapist and you have a strong, trusting relationship, because that's what it takes to open up and to be authentic and to be vulnerable, is that you trust the person that you're working with.
And I would even add to that, Doug, that if you, like Kevin said, if you don't like your therapist, to get a new one. But I see so many people, they finally get brave enough and they get a counselor, and maybe they misunderstand, because that happens too. You feel vulnerable, but then they just stop, and I would say, keep going, keep trying. Sometimes you get put on an antidepressant, it doesn't work. Keep trying, and I think if there's any message, is find the safe place to tell your story, get the help, and then keep on putting one foot in front of the other, because it is so worth it. Because when we're living in a place of trauma, we are reacting and overreacting to so many things. And we see it in kids with trauma, but an adult with trauma overreacting to things is not cool. And if we want to be the people God created us to be, we must get it from here out and share it. And then even better in the end, if we can bring someone along with us. Hey, we got Dan on here. I feel like let's just give him a chance. So Dan, what we were talking about, thank you for showing up, is trauma. And that once we understand we have the PTSD, what was different in our life,
So for me, I just learned like a couple of years ago that I actually even had PTSD, or what PTSD even was, because I had buried myself so far into addiction that I didn't really know any of that stuff. I started speaking about this stuff up at the diversion center with a good friend of mine, Johnny. And as I spoke about these things that had happened in my past is when I started to realize that they still affected me now. I did that podcast with you guys, and ever since then, my life's changed a lot. I'm able to speak about this without guilt or shame.
Nice. Thank you for sharing that. And then the other thing we talked about was, is PTSD disorder, or is it PTSI? Is it an injury? And I don't know if you can see Doug, our resident counselor, he was talking about how it actually is a wound and it is healable. And sometimes when we look at a disorder, we say it is what it is. But the fact that if it's an injury and a wound, that we can be healed. So I just thought I'd see if you had anything to say on that too.
Okay, absolutely. I believe it is an injury that can be healed. From what I've been through as a child and the things that I've had to do when I was a child to deal with it to now, I don't suffer from it anymore. I don't let it hurt me anymore. I use this as a tool to help others. So I believe it is a mental injury that can be helped with just by sharing your story, getting counseling, and spreading the word that it's okay. You don't need to be ashamed.
Mm-hmm.
Yeah.
The podcast is called No Longer Ashamed. And I think, Dan, you really bring that home, as in so often it's the shame that keeps us quiet. And then that's what keeps us in this perpetual place of hurting and reacting and overreacting.
Absolutely. And I know it has been for me. I held on to this thought that it was my fault for, see, how old am I? I'm pretty old now. So 30 years.
You are pretty old.
Over 30 years, I thought it was my fault that I did something wrong to deserve what I got. And honestly, it wasn't my fault. And then I was so ashamed because I grew up in an era that believed homosexuality was a sin and you just didn't do it. And if you did, it was wrong. So I felt like what he was doing to me put me in that category, and that I should be ashamed of myself because I let it happen.
So Dr. Doug has written a book, and he talks about a lot of things. But one of the big things he talks about is how hard it is for men because of, now they're adults. They're either remembering or thinking about it. They think they're still adults, and why men don't share. And again, I want to say the name of Doug's book. Doug, will you say it again?
Secret Shame is the name of the book, but the subtitle is A Survivor's Guide to Understanding Male Sexual Abuse and Male Sexual Development, and it's on Amazon.
And we've also got a link to it on the episode when we interviewed you. So if you're interested in the book, there is a link on our Facebook page, I believe.
Yeah, and we'll put it with this episode too. And so I think what I've really liked about this panel is I feel like it's been very informative. And I also feel like it's given us some other things to think about, and just what, Dan said, then we move out, we move from inside doing the work to outside to helping people. And thank you, Dan, for saying that, for us giving you a platform to share your story, that now it's been easier. And I know you are helping people. And Dan, the diversion center is when people go between the streets and rehab so they don't have to go to jail. So he's talking to people that have really had trauma in their life. And now that he's recognized it and he can address it, then now they can go, oh my gosh, I have trauma too. And maybe it wasn't my fault.
Absolutely.
So Dan, you said after our interview, things have changed for you. How would you describe that? What do you think was that process? I mean, how did that process work for you?
So we had spoke on my interview whether or not I could forgive him. And I have. I've learned to forgive him and myself, which is the biggest key, right? Like, I don't hold a grudge against him anymore. My life is moving forward. I don't let that slow me down or hold me back anymore. It is actually just becoming a building block for my future to help me help others. So, I'm doing amazing. I'm still clean. I got 3 years, 8 months, and I'm striving forward. I'm moving up in my company. I'm helping other companies grow. I'm a part of a fabulous recovery program out here, 5R. And I don't know, man, I couldn't be happier. For once in my life, I'm fucking happy. I can smile all day long and nothing gets me down.
And do you think helping other men has also given you the power to understand what you've gone through and where you've been, and realize that it is a process, but it is actually, you're able to grow through that?
Absolutely. Me sharing my story doesn't just help the person that's in the room. It helps me too. The more I share my story, the more healing I get. And I'm hoping that by hearing my story, it'll start their healing process. It's a long process. It doesn't happen overnight, right? And, I haven't had a nightmare about it since I did that podcast, which is just amazing.
Wow.
Wow. Thank you so much. I'm so glad you hopped on, even though it was late, because
sorry.
Oh, no worries.
I should have made it more obvious, but we will do this again. And I feel like this has been just a really great time to be informed and to connect. And I do feel like this work is important. And, whenever I share what I do, this podcast, people are like, what? Like, it's so not talked about. And I feel like we're sort of breaking the sound waves by talking
absolutely about it. And I share every time when I did my podcast, I told everybody about it. I share what you guys do. I've talked to other gentlemen trying to get them to tell their story, but that's, you got to be ready to do it. You can't just be told, hey, share your story. It's got to be something that comes from your heart that you're ready to do, because if you're not ready to do it, it's not going to help you or anyone else. So, and I think that what you guys are doing is amazing. I think that once we get it out there a little bit more, there's going to be a lot more men that are going to be willing, to share their story. And God's got a plan for everybody and everything.
So that's it for today.
We are going to have a prayer time if you want to stick with us. If not, we believe in you.
We want to hear from you. We want to hear your stories.
If you like this podcast, please rate and review, because that's how other people can find us. And we really want to spread this message.
Heavenly Father, I thank you for these men who are willing to be vulnerable and to share their stories. And Lord, this is not one of those fun things to talk about, but it's so important. And I feel like that's what hopefully we brought today, was hope to people, to give them permission and the ability to at least begin to share their stories and to look into maybe what's causing all these symptoms of post-traumatic stress when they don't even realize they have it. Lord, I pray the eyes will be open and healing will be available, that they will see there is a way to get the help they need, Lord. And I just thank you for everyone here being willing to share their story and be open about not only their abuse, but their trauma, in your Son's holy name.
Father, thank you for this ministry, this podcast, Lord, that reaches so many men and women who were abused, Lord. For those listening now, if they themselves or they know someone who struggles with PTSD, Lord, just show them the right ways where they can do that next right thing in their healing, Lord, that you would give them that encouragement and that wisdom to reach out for help, because help is out there. And this is not a death sentence. This is not something you're stuck with forever, but you can heal. It is a wound that can heal. And that's so encouraging to hear, Lord. And just pray you would guide those men and women listening who need healing from those wounds.
God, I come before you and I just pray that for every listener who's listening, that if they are struggling with PTSD, that the Holy Spirit would just begin to whisper to them and help them to accept and understand that they're struggling with PTSD, and help them guide their steps and help them to get to a trauma-informed therapist who can work through your spirit and work to help guide them toward healing. God, we know that you are ultimately the healer, but God, you use human vessels to bring healing to this earth, to touch people's lives. And for every person who's listening who has a therapist and is working toward overcoming PTSD, I pray for each one of their therapists that you would provide them with divine inspiration to deliver the words and the healing that each person needs to have and to hear, to help make them whole again. And we entrust all the listeners into your hands, God.
Father, I thank you for all your blessings, especially for all these men that are so brave to share their story, and for all of those who are helping us are people that we trust, the people that we share with, the people that we are able to open up with. And I just pray for your blessing in their lives and for your Holy Spirit to work through them, Lord, and that you would be the light shining through our lives to those that need healing, to those that need to hear these stories and these words, that you would be the Holy Spirit that would guide them towards the healing they need, Lord. I pray that you would just continue to give us wisdom and the courage to share, and the guidance that we need to find the people that do need help, that do need hope, your hope. And Lord, I just thank you that you are our hope, that you are the light in our lives that helps us get through this, all these things that we've been dealing with, that because of you, we do have hope in our lives. Lord, and I just pray you would bless those who are listening and be persistent in their lives and in their hearts, that you would guide them to that sense of hope in their lives. In your name I pray. Amen.